Do you know when blood sugar levels become dangerous? Let's dive into the world of hypoglycemia first. Hypoglycemia, simply put, is the medical term for low blood sugar. It's when your body doesn't have enough glucose, its primary energy source. But how low is too low? Generally, a blood sugar level lower than 70 milligrams per deciliter is considered hypoglycemia. That's the danger zone. You might be wondering, how do I know if I've entered this danger zone? Well, the body doesn't stay silent. It signals you with some telltale signs. You might feel shaky, sweaty, or unusually hungry. You may also experience a rapid heartbeat, sudden mood changes, blurred vision, or even have difficulty walking or talking. But it's important to remember that symptoms can vary from person to person, and sometimes you might not feel any symptoms at all. This can be especially true if you have had diabetes for a long time. This is known as hypoglycemia unawareness, and it can be quite dangerous. What makes hypoglycemia a serious condition? Well, if left untreated, low blood sugar can lead to unconsciousness or seizures. It can disrupt your ability to perform tasks that require concentration, like driving. In severe cases, it can be life-threatening. So, why does hypoglycemia happen? There can be several reasons. Maybe you took more insulin than needed, or perhaps you skipped a meal. Rigorous exercise can also drop your blood sugar levels. It's like a delicate balancing act, and sometimes the scales can tip. But it's not all doom and gloom. Hypoglycemia is manageable. Regular monitoring of your blood sugar levels, eating balanced meals on time, and taking your medication as prescribed can help keep your blood sugar levels in check. Now let's flip the coin and talk about hyperglycemia. This is the term used to describe high blood sugar or glucose levels. It's a condition that can occur when your body has too little insulin, or when it can't use insulin properly. You see, insulin is a hormone that helps move sugar from your blood into your cells, where it's used for energy. When there's not enough insulin or your cells resist its effects, sugar can build up in your blood. This is what leads to hyperglycemia. Now, how do you know if you have high blood sugar? Well, there are several symptoms to watch out for. You might experience increased thirst and frequent urination. Other signs can include fatigue, blurred vision, and headaches. In severe cases, you might even experience shortness of breath, dry mouth, and a rapid heartbeat. But when does high blood sugar become dangerous? While it can vary from person to person, generally speaking, a blood sugar level above 180 milligrams per deciliter can be considered high. If your blood sugar level is consistently above 240 milligrams per deciliter, it's critical that you seek medical attention. Levels that high can lead to serious complications if not addressed promptly. If left untreated, hyperglycemia can lead to diabetic ketoacidosis, a serious condition that can lead to a diabetic coma, or even death. Long-term complications can include heart disease, stroke, kidney disease, vision problems, and nerve damage. Remember, it's important to monitor your blood sugar levels regularly, especially if you have diabetes. Early detection and treatment of high blood sugar can help prevent these complications. Just like hypoglycemia, hyperglycemia is not to be taken lightly. High or low, any significant deviation from normal blood sugar levels can lead to serious health issues. That's why it's essential to understand these conditions, recognize the symptoms, and take action when necessary. So, what should you do if you encounter dangerous blood sugar levels? Well, first things first, don't panic. Panic can cause your body to release stress hormones that might further destabilize your blood sugar. If your blood sugar is dangerously low, eat or drink something that can rapidly increase it. 15 grams of fast-acting carbohydrates, like a small glass of fruit juice or a few glucose tablets, should do the trick. But remember, moderation is key. Overcompensating can swing your blood sugar too high. On the flip side, if your blood sugar is dangerously high, you may need to inject insulin or increase your water intake to help flush out the excess sugar. In both cases, monitor your blood sugar closely. If it doesn't stabilize or if you start to feel worse, seek emergency medical care immediately. Every second counts when it comes to your health. Remember, acting swiftly can be the difference between life and death. Now you might be wondering, what causes these dangerous blood sugar levels in the first place? Well, there are several factors that can contribute to these spikes and drops. One of the main culprits is diet. Consuming foods high in sugar or carbohydrates can lead to a rapid increase in blood sugar levels. On the flip side, not eating enough can cause your blood sugar to plummet. Exercise is another key player. While physical activity generally helps lower blood sugar, too much exercise without proper fuel can also lead to low levels. Then there's stress. Both physical and emotional stress can cause blood sugar to rise. Illness is another factor. as your body tends to release sugar-storing hormones when you're sick, which can result in high blood sugar. Lastly, certain medications can also affect your blood sugar levels, either by raising or lowering them. Understanding the causes can help us prevent dangerous blood sugar levels. So, how can we prevent these dangerous highs and lows in our blood sugar? Well, one of the most effective strategies is through a healthy diet. Consuming a balanced mix of carbohydrates, proteins, and fats at each meal can help keep blood sugar levels steady. It's also important to stay hydrated and limit the intake of sugary drinks and high-sugar foods. But diet isn't the only factor. Regular exercise plays a crucial role too. Physical activity helps your body use insulin more efficiently, which can lower your blood sugar. Whether it's a brisk walk, a swim, or a bike ride, any form of exercise can make a significant difference. Next, let's talk about stress management. Stress can trigger a rise in blood sugar levels. Hence, incorporating stress management techniques like deep breathing exercises, yoga, or even a hobby can help maintain optimal sugar levels. Lastly, regular health checkups are indispensable. These allow for early detection of any fluctuations in blood sugar levels, enabling timely intervention. It's also a good idea to monitor your blood sugar at home. Remember, each individual is different, and what works for one person may not work for another. Therefore, it's important to work with your healthcare provider to create a plan that's right for you. Remember, prevention is better than cure. So, let's strive to prevent those dangerous highs and lows in our blood sugar and pursue a healthier, happier life. We've covered a lot of ground today, and I hope this information helps you manage your blood sugar levels better. From understanding the dangers of hypo and hyperglycemia, to immediate actions, risks, causes, and prevention strategies, we've unpacked it all. Remember, this content is intended for education, and isn't a substitute for professional medical advice. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health and wellness content. Stay healthy and take care.